Hey, Pussy I know, been a long time. Been away and on the road for quite a while. Been working a little bit, pay for all those tours I've been paying and all those trips. But I wanted to do a quick update and as well as a little video I've been thinking about doing for quite a while now. So update wise, still that video on the wounds. I'm working on it actually next week, the third of November. Yeah, so a week and a half. I'm going on a conference on wounds, so I was waiting for that to get more knowledge about that. So I'll be on a 4 days of wound conference in Ottawa. And actually, I'll probably put some videos and stuff like that of my trip over there, as well as fall and winter is coming. Well, fall is there, winter is already started for us as well too. Already been like -12, -10 in the Rockies. So, but be putting a video on hypothermia and the treatments. So that's another one coming in, and again, few ideas as they come along and stuff. But those are pretty much the two big ones I'll be working on and stuff. Otherwise, we're getting more people on the channel. Thank you for the subscribers, very appreciated. And hope that we'll be able to make some more videos and that you guys will enjoy. But Pussy will enjoy. But this one, kind of a special one. There's a lot of things on the YouTube on shit hit the fan, kind of like collapse economic and stuff, and there's always a part of medical treatment, because if that would happen, right, basically would be one of the big component of it. So I'm always interested to look at those things and kind of, see what's been told and stuff. And there's a lot of things sometimes I kind of disagree from a healthcare professional point of view. And surprisingly, too, sometimes those are healthcare professional. Obviously, those are my opinions. I mean, I never been in. The thing, too, to remember is that those things never truly happened before, beside maybe the big collapse in Argentina and stuff like that. The truly impact that a scenario like this would happen, it's very unlikely. Not many people can say, oh, I got experience, so I'm speaking from experience point of view. From a disaster point of view, even that, for example, Katrina and other disaster like that, you still have systems in place, like like other, for example, in Katrina, other states and things like that could come and help those states, or even other countries. So a lot of time in those scenarios, they talk about the full collapse of the whole economic kind of things and stuff, man. And not that I believe that could really truly happen. And I have my own views on the reason of why Argentina couldn't really happen. Couldn't happen on a wide scale, like in Canada or the States and things like that. But to play along, like, sure, okay, let's go ahead with the medical stuff. And but one thing that I always found with some of those videos, or those recommendation that they give, is they try to give the same care that the system would be able to provide with this. So, for example, intravenous antibiotics and things like that. And if you look at, for example, the third world countries or disaster zones, you don't have the hospitals, you don't have the supplies. So to be able to, even to think that you would be able to have enough supplies to support things like that, it's unmanageable, because even in like if you would think about like hospitals and things like that, how much like supplies they have to just like maintain like a day, or even just like, and we're talking about like 1 or 2 patient, just the medication that you need, like if you're working ICU or critical care or things like that. It's just amazing like how much medication you would have to keep to do that. So right there, just all on the supply line, it's quite difficult. So I'm going to address mostly 3. So that's more like on the medication part. That can be have a big can have discussion about should we not, and what kind of medication we should have. Should we go more for like the herbs and things like that? And I don't want to go, because that almost could take a YouTube video on its own. But 3 things that I really would like to discuss a little bit more is airway management, wound management, and fluid resuscitation. And why those 3 is because a lot of time those 3 comes back over and over and over and over. And there's a lot of things I disagree with what has been said. First, let's go with ABC. So let's go with the airway. Airway management. A lot of time they talk about intubation. Intubation, so to go, it's when you put like those tubes. So when you see in movies and everything is when you put a tube in a trachea to be able to breathe for the person. So an intubation, that's what we call it. There's different ways that you can do. So there's what we call endotracheal tube, which is endo, so it goes in the trachea. So this is like the more secure airway you can have, and then you can have others. And you can go back in my video on airway to explain a little bit more difference ones and stuff. But if you have an intubated patient, that means one, you have to so you intubate the person. First, you need to have medication to intubate, because unless the person is not moving, which is most of the time happen, either you're dead or you're near dead, you'll need medication to sedate them, or we call rapid sequence intubation. So basically you give them medication so that you can intubate them and things like that.